Hello, I'm Jim Wells. I'm a psychiatrist in Hillsborough, North Carolina, and have for the last 36 years experienced the practice of psychiatry as very rewarding. My practice perspectives include working to understand a person's entire medical, emotional, family, and social history so that I can potentially get better results than just focusing on one or two currently troubling symptoms. I also think that really listening with care and compassion to someone's concerns, pains, hopes, and dreams can frequently allow for healing of old pain and an increased capacity to make life choices that can result in greater peace and satisfaction, rather than the difficulties that had previously been experienced so often. In cases where dementia limits what someone can share about themselves, I've frequently found that obtaining the perspectives of family members and other caregivers can make it possible to discover interventions that effectively alleviate emotional distress. I also find that practicing more effective life skills, both personally and teaching them to others, including meditation, regular exercise, nutritious eating, and the validation and acceptance of the perspectives of others, can make it less difficult to accept and manage, to the extent possible, the inevitable twists and turns of daily life. These skills, when practiced conscientiously, can, I think, make life difficulties more bearable for all concerned, the person who's practicing the skills and the people around them. Psychotropic medications, when carefully tailored to an individual's particular needs, can sometimes be extremely beneficial also. In my experience, when psychotropic medications are carefully prescribed, always beginning with a very low dose so as to avoid adverse side effects as much as possible, they can often help emotionally those folks who have had trouble with obtaining relief from psychotherapy alone. And I've also found that alleviation of emotional distress can sometimes take months rather than just days. Everybody would like a quick fix to whatever is troubling them, and sometimes the right medicine or just having a few opportunities to discuss the troubling issue, can in just a few days make a big difference. But very often it takes much longer. And I think, though, that what is important is to realize that whether it's only a short time that's necessary, or perhaps a much longer time, perhaps even years, relief can occur. And the important thing for both the person who is experiencing the distress and the person providing help to remember, I think, is that with time and patience, the situation almost always can improve significantly. Thank you for listening, and please check out my website at www.creativebalance, all one word, .com. creativebalance.com. Thank you very much.